with the big question right now, is there a doctor shortage? How big a problem is it? I have Zahid Khalid, who is the Chief Financial Officer of Great Lakes Medical Billing. Zahid, are you there?
I am here. How are you?
I'm great, sir. And you?
I'm great. Thank you. Thank you for having me.
Well, thanks for being part of the Morning Drive show. And interesting question is, as certainly with Obamacare and the Affordable Care Act coming into play, what are we looking like in terms of healthcare professionals, in particular doctors, and being able to take care of the amount of people we have?
Given the current situation, and we can only project based on what we see today, which doesn't mean that what I'm going to say actually is going to happen. As a matter of fact, I'm betting against it happening. But what we see happening right now based on projections and on the fact is that there's going to be roughly about 90,000 plus physicians short than what we need by 2020. So that's right around the corner. On top of that, you have a large population, relatively large population of physicians retiring. We're not bringing the same number into the mix because of several reasons. One is that physicians are getting discouraged because of the complexity of the bureaucratic process to get reimbursed, the reduction in reimbursement rates from Medicare, and then the threat. If you are a physician in private practice, you're going to get reimbursed for the same exact procedure less than if you were to do the same thing at a hospital. So what you're going to have is, what you're seeing already is a lot of physicians are thinking about selling their private practice and going work from the hospital. That's a really bad deal for the physicians, frankly. And because, when they retire, just to give it one point, is that if you choose to shut down your practice and go work for a hospital, you're not going to get $1 million check when you retire from that hospital. That's just not going to happen. But if you sell your practice, you can easily make that kind of money if you're in the right area with the right kind of client mix. So really what's happening is that physicians are not coming online. The Obamacare is bringing more people that are going to get insured. However, those people a lot of them going to be supported by Medicare. But physicians are, if you cut down the reimbursement rate for procedures for Medicare versus Medicare, by the way, already pays 30-40% less than private insurance. So physicians are not thrilled about accepting Medicare patients to begin with. You further cut down those rates by another 30%, and we are seeing it happening already. A lot of our clients, our physician clients, they are stopping their acceptance of Medicare. So now you have people that are insured on paper, but nobody wants to take them. So that's going to be a really bad situation. So really, I don't think that the powers that we have taught this whole process through or have connected all the dots, because at the end of the day, you're going to look at economic decisions. We are shoving risk down the throats of insurance carriers, and we are limiting the reward. That is completely upside down to how the modern economy in a free market system works.
And it's simple supply and demand, too, correct? I mean, as we move forward, as more people come into the system and the number of doctors either decreases or doesn't increase to the level of the amount of people coming in, isn't this going to automatically drive price up? Isn't this automatically going, if doctors, like you say, aren't going to take Medicare or whatever the case may be, they're going to they're end up going to get paid more because they're in more demand?
You just nailed the crux of the issue. You just nailed it on the head right there, is supply and demand. The whole Obamacare, the healthcare change right now, is all focused on the demand side. How can we bring more people online? How can we get more people insured and all that stuff? And people are not looking at what's going to happen to the supply, because you can create all the demand you want, as we know, but if the supply isn't there, you're absolutely right. There's going to be people who are going to go unserved, and those that can get served are going to be paying much higher prices than they're paying today. So you're absolutely right about that. But we really need to look at the supply side and see, and supply side is not just physicians. You also have to look at all the support structure that is around them, such as private insurance carriers, because we certainly don't want a one-payer system, i.e. the government of this country, because we know what happens with that.
Yeah, and we live in you're calling Daytona Beach, Florida, and certainly we have an older population here, and with the baby boomers continuing to move into getting older, the demand's there already. It's already there. We have good structure here, but do you see a two-tier system coming out of this possibly, where those that can afford insurance and private care will get a different level than those who are maybe just Medicare and Obamacare?
Well, in a way, it's already here. And if you're familiar with the concierge healthcare service or a concierge model, right, where you basically pay a fixed monthly fee to a physician, and again, keep in mind that model only is for primary care. That does not mean your hospital visits are covered, or your with that fixed monthly payment, or your medication, or your lab tests, or any if you have to see a specialist. None of that is covered. And then again, it is for those people that can afford. I mean, a lot of Americans with the reduction in real wages over the last 2 decades, they cannot afford another $50, $60 a month. I mean, that's just not an option for them, especially when on top of that they still have to have some insurance. So it is it's going to be a two-tier system, but frankly, I think it bodes really well. And I say that in a tongue-in-cheek manner, is that I think it bodes well for offshore healthcare providers, because you might see a big increase in healthcare tourism to other countries.
Zahid Khalid, thank you so much for being our guest here in the Morning Drive show, and hope to talk to you again soon. As this is a problem that will evolve over time. I don't think this is we know today, like you said, we don't have a crystal ball quite yet on how this is going to work out, right?
Well, absolutely right. You're right, and thank you for having me. You have a great day.
Yeah, you do the same. Thank you very much.
All right, excellent interview.